Hi everyone, this is Dr. Bhupesh from Dr. BKM Institutes. Talking about tomorrow's letter, I have uploaded a letter named as Suzanne Matthews letter. It is not that this letter will come. Obviously, this letter will not come, but kind of letter can come. So I would like to make you understand about this letter. What is happening, why this letter is one of the most difficult letters. So that is what we are going to discuss now. Suppose if a patient had an accident, he went to a hospital. So the patient went to a hospital, he had an accident. After that, the patient comes to our rehabilitation center where you are a community nurse. So you are a nurse, patient came from the hospital. And then the patient now is going to the next person for the follow-up care. So this is kind of a strange letter that can come when you are the middle party. So that is what causes the problem, that you are the middle one, and that is where letter becomes difficult, because you have to, in the first paragraph you will have to explain about this thing, then you have to tell about what you gave as a part of treatment, and then you will send the patient for the follow-up care. So this is how it is. To make it very easy, I would like to tell you, it's very easy, simply. So you will say this letter, I'm just going to ask you, please can you write in the chat box that whatever I am writing is visible, this letter, like I have written, this letter is being written. So is it visible to everyone? Can you write in the chat box, please? This word is visible to everyone? Yes, 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 yes. Thank you. All right. So I'm just going to take this thing. All right. Okay. So I'm writing here, this definitely would be visible. So I would write it from this. Now you are a nurse at this place. So you are in the middle. So you have to refer the person for the follow-up care. So I can simply, the best way and the easiest way to write is, this letter is being written regarding Mr. X, who needs follow-up care, and hence, and or otherwise so is being referred to you, who needs follow-up care, therefore he is being referred to you. This is the easiest way. Obviously you will pass with this, there is no problem that you will not pass. So this technique is to be used when the letter is difficult and you are unable to understand anything. So you will write this simple, that this letter is being this letter is being written regarding Mr. X, who needs follow-up care, therefore he is being referred to you. That is how simple you can make it. Very simple. But if the letter is not that difficult and you are able to understand everything, suppose this is the hospital where patient came with the accident, how to write this thing in a better way? Let us take this thing. This letter is being written. I will tell you all the ways to write. OET is never difficult. You just need to tell the story in the first paragraph. This letter is being written regarding Mr. X, who had an accident and was admitted to, name of the hospital if it is given, to, suppose if it is given, Royal Melbourne Hospital, Royal Melbourne Hospital, on this date. So you will write the date on 5th March, whatever the thing is, 2006, suppose. So basically now you are completing this part, that this patient, Mr. X, who had an accident, was admitted to Royal Melbourne Hospital on 5th March. Then you will say, after treatment, simple, after treatment, he was referred to our center. Simple, referred passive voice, he was referred to our center. Why passive voice? Means he was referred from the hospital, yeah, by the hospital, to our center. And after taking our services, his condition has improved. So now this is simple. So what we are saying, that the patient's condition has improved at our place. So this is where patient, however, he needs follow-up care. Now this is a better way of writing. This will get you 350 very easily. However, he needs follow-up care. So he is being referred to you. That is how simple it is. So you have told about this part. This letter is being written regarding Mr. X, who had an accident and was admitted to name of the hospital on this date. After treatment, he was referred or he was shifted. You can write shifted is not a good word, because shift means that patient is patient has shifted from hospital to your center. But maybe your center is something that does not attend the patient at night, that does not keep the patient. So shifted word can be wrong if the patient has not been shifted. So you simply say referred. Referred is a safe word, because even if the patient is living at your place for few days, or if patient is taking services from you, referred word is a safer word. He was referred to our center, and after taking our services, his condition has improved. However, he still needs, this is also a good word, he still needs follow-up care, so he is being referred to you. Suppose now this letter is being written to GP. GP means patient's GP. So suppose that is the different thing over here. Suppose GP is a known person to patient already. So patient is well known to GP. So in that case, what will happen? This will become a letter like, this letter is being written regarding your known patient. That's it. Mr. X, who had an accident, this after treatment, he was referred. However, he still needs follow-up care, and being his GP, GP means general practitioner, that being his regular GP, he is being referred to you for the required care. Now, this is the only change. Let us read it now. So this letter is being written regarding your known patient, because he is your regular patient normally, but this time he had an accident. He came to emergency department. So this letter is being written regarding your known patient who had an accident and was admitted to Royal Melbourne Hospital on this. After treatment, he was referred to our center, and after taking our services, his condition has improved. So the only thing that is coming twice is afterward. If I can change this word, after treatment, he was referred to our center, and following our services, this will look much better. So these are the small changes. You can make it better and better just with simple thoughts. And following our services, his condition has improved. However, he still needs follow-up care, and being his GP, he is being referred to you, or you can write even better, you are requested to provide him the required care. So this is the best way of writing. And if the first paragraph is fine, you will definitely pass. And you are writing all the commas. This is your connector, comma before the connector, then after treatment, comma, he was, and following our services, comma, his condition has improved. So noticing this small change, full stop. However, he still needs follow-up care, and being his GP, you are requested to provide him the required care. Now, this is like complete good paragraph. So this is the kind of a letter that can come. Or there can be discharge back letter. Again, there is not much difference between discharge back letter or even the referred back letter. So this is like a referred back letter. So again, why to now, as soon as I told you about referred back letter, you guys become even more confused. Oh my God, what is discharge back letter? What is referral letter? So it's better not to say it anything. The best thing to do about OET writing, don't call it referral, visit, or whatever letter. Just write the situation that this letter is being written regarding your known patient, Mr. X, who had an accident and was admitted to this on this. After treatment, he was referred to our center for rehabilitation. You can also write this word, rehabilitation, if that is the word that is given. And following our services, his condition has improved. However, he still needs follow-up care, and being his GP, you are requested to provide him the required care. So this is how simple you need to think. Suppose if it is not a referred back letter, it is a simple visit letter. Then also I told you, then if it is not a GP's letter, so you will say this letter is being written regarding Mr. X, who had an accident. After treatment, he was referred to condition, however, still needs follow-up care. So he's being referred to you. Again, please listen to this video. And if you have any doubt, obviously you can ask me. Let me ask people over here if you have any doubts. I'm unmuting you, and I would request not to have the noises from the background. But if you have any doubt, you can ask me, please. Any doubt about this particular thing. आप कुछ भी पूछ सकते हैं. Any doubt? I have unmuted you. The people who want to ask can ask me anything, and it is being recorded. So please ask whatever the question you may have regarding this thing. It's a simple thing. So if it is a non-GP, then only thing that changes is non-patient, Mr. X. However, he still needs follow-up care, and being his GP, you are requested to provide him the follow-up care. That is the only change, because again, it is not ratta or mugging up. It is not mugging up. It is something that is logical, that we are talking about a patient who had this problem, and then it was done. After our services, he is better. Then next paragraph, you will simply write about social history and medical history. But if the patient is known about GP, then obviously you will not write about the social history and medical history. Then you will say during hospitalization, means during Royal Melbourne Hospital, the patient was given this and this thing. Then next paragraph you will make, then on this date, he was referred to us, referred to our center for follow-up care. That is your third paragraph. And then you write the paragraph now, that now the patient needs this and this thing. So that becomes the fourth paragraph. So that is how simple OET is. It is all about logics. You have to make OET letter the easiest of the letter to read for your examiner, for your doctor who is reading the letter when you are originally working as NHS nurses, doctors, or New Zealand doctors or nurses. So that is the main thing. I hope you all have understood. If you have any doubt, you can ask me on the recording. If you want me to switch off the recording and then you want to ask your doubts, then also you are welcome. Any doubts, please? Any doubts?
Yes, sir. Like in the fourth paragraph, we started as a now, or we can start. It would be greatly appreciated if you.
Both are okay. Suppose,
Okay.
imagine the situation. So I'm writing a letter to GP. So I'm telling the GP, now it would be greatly appreciated. I can say uh it would be greatly appreciated. Both are same thing. It doesn't make a lot of difference. So I can write now that we have done all the things. Now patient needs this thing. Now it would be greatly appreciated. Even if I do not write now, that is not a problem again. It's all good. It
All
doesn't,
right, sir. Thank you.
these small words do not change anything. Don't put any pressure on yourself for these small things. Any other question, please, by anyone? No matter how difficult the letter is, just write what you feel like, what you have learned from the letter. Absorb it, then try to figure out the main purpose. Okay, this is a follow-up care letter. Okay, this is a letter where patient's condition is not improving, so he needs specialized services. Means the letter is written to some orthopedic surgeon. So then also it's very simple, just taking the last, because a simple visit letter can come as well. So you simply say this letter is being written regarding Mr. X, who, simple, let's write the most simple, who was taking our services, but there has not been any improvement. Now he is suspected with, if it is a question mark thing in the present visit, that patient is having some suspected disease. So you say there has not been any improvement. Now he is suspected with this problem. So he is being referred under your expertise. That is how simple the story is. That is how simple the story is. Or you can simply write, this letter is being written regarding Mr. X, who is suspected with this disease. Simple. So he is being referred under your expertise. So you can make it as simple as you want. The only thing that you have to take care is not to do mistake. OET writing is all about doing mistake or not doing mistake. If you do not do any grammatical mistake, if you do not do any mistake by making it complex, you will automatically get 350 or B very easily. The less mistakes you have, you can also reach to 450. So 450 and 350 letter is no different, because you are also writing 200 words. The person who is getting A grade is also writing 200 words. The only thing is that how many mistakes have you done. So if you do not do any mistake, you will get 450. If you have done 2 or 3 mistakes, you will get 350, 370. If you have done 5 or 6 mistakes, you will get 300. That is the passing score for the nurses. For the doctors, it is 350. And if you do more mistakes, which I don't think anybody of you will do, because I trust you a lot, guys. Thank you very much. This is Dr. Bhupesh from Dr. BKM Institutes. And before I close up, do you have any question regarding the writing, or should we start with the reading class? Any questions?
Good evening, sir. I have a doubt regarding the writing part.
Yes, Dr. Mahima.
So, having listened to the previous thing that you said about the grammatical mistakes which the examiner might see in our letter, so what are there any specific criterias which are to be, look after while writing a whole paragraph? Like how are we judged and graded on the basis of our writing?
See, Dr. Mahima, the question is very simple. Let's make this question simple. I am a specialized doctor to whom you are sending an email, and you are a GP. You are sending me email. I will not judge you individually on the basis of uh, you know whether that your lexical response is good, your written discourse is good. What I will judge you normally is whether I have received the message or whether you have done any grammatical mistake. Then, once I decide whether I will pass this person or will fail this person, then I put the grades, that grammar C, message cleared, written discourse C plus, lexical response this. So means if you are writing a good letter with a good grammar, with 100% clear purpose, it is 100% certain that you will get 350, more than 350, or even 450. It is about how clear the message is, how good the grammar is. Connectors play a very important role, but not the compound or the very complicated sentences. Connector means, like if I say, he had fever, comma, for which he required antipyretics. So this is a good connector for which. So connectors play a very important role. Grammar play a very important role. The least the mistakes, the better it is. Cohesiveness, written discourse play a very important role, because if I have not mentioned the medical history first and I say the patient has diabetes, in the first visit of the patient, I give them the treatment of diabetes without telling the history about diabetes. That means I have made it complex. So first of all, in the second paragraph, I will like to tell that he is having diabetes. Then on the first visit, diabetic diet was given. So it is about that following that normal doctors or nurses protocol, that eventually when patient comes to us in the hospital, we have that thing, chief complaint of the patient, then medical history, social history, then what happened in the previous hospitalization. That is the same thing we need to follow. So that makes it more practical, easy to be read by the examiner, and that is what gives you more marks. So it's again, we make it complicated by breaking it into components. So make it simple. Grammar is good, connector is good, message is clear, you are pass. You will pass. Did I answer your query, ma'am?
Yes, perfectly. Thank you so much.
So not to make it complicated at all, because that is where human brain gets stuck. This is work of computers. This is work of the people who are giving marks to you. But when it comes to us being nurses and doctors who want to pass, simple. Don't make it simple letter with perfect follow-ups. Like, you should not write last visit first and then you are writing about middle visits. Obviously it will make it cumbersome. So first purpose, that is the last visit. Small purpose, not everything. Medical history, social history, then chronologically. First visit, second visit, third visit. If first, second, and third visit are similar, To save your word count, you club them during the first 3 visits. Then you say during subsequent visits. Then you write today the patient is having this problem. So making it as simple and readable is what is our endeavor, what is our effort. Okay. Any other doubt apart from Dr. Mahima? Please. Any questions, any things that you would like to ask, guys? No. Sounds all good. So let's start the reading session now without wasting any time. But again, tomorrow when the letter will come, as few of you are taking exam tomorrow, just take it easy. Just take it easy. Understand what is the main person to whom you are writing the letter. And then understand the person to whom am I writing the letter, what is the problem that he is going to solve, what is the main problem. That main problem is the purpose. So purpose of OET letter is never positive. Purpose of OET letter is always negative. That is why it is the purpose. That is why you are referring the patient, because it would be a negative thing. That is why you need some other services. It may be a follow-up care, it may be specialized services. Maybe that patient earlier was having bit of vision loss, and by the time he was taking treatment from you, his vision almost got nil. So you will send him to ophthalmologist as quickly as possible. Suppose a patient is coming to you with some psychological issues, and you were taking care of the patient as GP or nurses at community. You were thinking that he's gonna get fine with the counseling. All of a sudden, he has that acute manic episode, and that acute manic episode, obviously, then you will refer the patient immediately to psychiatrist. So that is what OET letters is all about. So you write the message, this letter is being written regarding Mr. X, who was visiting our clinic or who was visiting our center because of psychological issues. However, even after counseling, his condition has not improved. Rather, it has got worse. Rather, now he is having this. Full stop. Therefore, he is being referred under your expertise on urgent basis for the same. So that is what is the purpose. So purpose would always be negative, because that is why it is the purpose of the letter. So what is the main problem with the patient and the person who is solving that problem? This doesn't mean that the main problem of the patient is, suppose, fracture. But you are writing to psychiatrist, then you will say the patient's main problem is fracture, due to which he is upset or he is unable to do his work. That is why he is being referred to you. Due to which he is unable to do his work. That is why he is facing psychological issues. That is why he is being referred to you. So that is the purpose. That is the flow of the purpose. Fracture, unable to work, causing him psychological issues. Therefore, he is being referred to you if you are writing to a psychiatrist. If you are writing to orthopedician, then even if the patient has psychological issues, you will not write it. You will write to orthopedic surgeon, same kind of a patient. This letter is being written regarding this person who had an injury and now he is suspected with fracture. Therefore, he is being referred to you. So orthopedic surgeon, even with the same case notes of the patient, will not include that data of psychological issues or not able to work. So orthopedic surgeon would like to know what is the main problem, that is fracture, and maybe if he wants to resume work, but he will not deal with the psychological issues. So the same patient having the same case notes but referred to a different doctor also counts in the data selection. So data selection is the main thing according to the person to whom you are writing the letter. So that is the main thing that you have to find out. So please keep an eye open tomorrow, and that is the only thing you need to know in OET letter. Once you figure out to whom you are writing, what is the purpose, you are done with your exam. If your grammar is good, 100% you will pass. There is nobody that can stop you from getting 351. So thank you very much for your patient hearing, and I'm just going to stop this recording for you. Thank you.